Welcome back, dear friends. In the previous modules, we have discussed about the interventional pulmonology part 1 and part 2. Here we are discussing the interventional pulmonology part 3. In this module, we are going to discuss about Introduction to Interventional Pulmonology part 3, anesthetic considerations, airway stenting, video assisted thoracoscopy or medical thoracoscopy, and some of the clinical vignettes. Introduction. As you know, interventional pulmonology procedures are highly risky. The procedures like airway stenting and video assisted thoracoscopy we are discussing today, especially in procedures involving rigid bronchoscopy and airway stenting, both the anesthetist and interventional pulmonologist will be working on the airway. So there's a concept of shared airway. So it's very important you have to work, you have to do a therapeutic intervention as well as anesthetist has to ventilate the patient, maintaining the patient's saturations and vitals stable. So these are very highly risky procedures, no margin of error. So in that sense we are going to give a in-depth knowledge on anesthetic considerations, which will be discussed in two sessions, and then there will be two sessions on airway stenting and also on a medical thoracoscopy and followed by a clinical vignettes. That completes the interventional pulmonology part 3. So anesthetic concerns, we are discussing about what are the actual anesthetic concerns, how you evaluate the patients in preoperative checkup, complications of IP procedure and how to mitigate it, how to administer anesthesia for IP procedures, securing the airway by various methods, ventilation modes and settings required for interventional pulmonology procedures, and also in-depth discussion on jet ventilation and apneic ventilations. And these things will be covered in two video sessions. Coming to airways stenting, again it will be discussed in two parts. The first part will discuss about what is stent, what is an ideal stent, what are the checklists you need to follow before putting stent to a particular patient, and also flow diagrams to choose which stent is required in benign and which stent is required in malignancy, and what are the follow-up plan. Okay. Whereas in second part of the airway stenting, we will discuss about type of stents like silicone, Montgomery tubes, metallic tubes, expandable and self-expandable. We'll discuss about all those things in detail, and we'll also discuss about the future directions, especially mention about 3D stents. And coming to the last section on interventional pulmonology part 3, video assisted thoracoscopy, or also known as medical thoracoscopy. We'll discuss about the introduction to medical thoracoscopy, brief history of medical thoracoscopy, role of medical thoracoscopy in undiagnosed pleural effusion, what are the essential differences between medical thoracoscopy and video assisted thoracoscopy, and also procedural details and complications and clinical vignettes. In medical thoracoscopy, we'll also discuss about both rigid and semi-rigid or flexible thoracoscopy. In the clinical vignettes, we will discuss about few case scenarios and couple of videos on the medical thoracoscopy. So that completes the interventional pulmonology part 3. Thank you.